Good morning, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division and Fiscal and Administrative Services Division. This webinar is being held on December 4th, 2020, and is scheduled to run from 10 a.m. until 11 a.m. We want to thank you for taking some time to join us for this webinar. For those who may not know me, my name is Steve Profiter, and I'm the Director of the Early Learning and Care Division at the California Department of Education. We started these webinars to make sure we were getting the most current information out to you all. We've been through a few spikes in the COVID-19, but this one that we're currently in is proving to be the worst yet. We do urge you all to continue to be vigilant, wear a mask when you're out, keep social distancing, and following public health requirements. We're as I mentioned, we're in the midst of a pretty large surge where yesterday the governor announced a regional stay-at-home orders, and it's probably more accurate to say plans for regional or criteria for regional stay-at-home orders based on ICU capacity. We know that programs have questions about how the governor's announcement impacts programs, and at present there is no change to existing guidance or executive orders. In fact, in the order, it calls out childcare in pre-K specifically that they are allowed to remain open. But we know that there are criteria from this year's Budget Act that would hold harmless contractors or programs that had to close for a number of reasons. And so programs can refer to Manager Bulletin 2018 for guidance on requirements for being held harmless. And for other questions about remaining open, please check with your regional licensing office and the local county public health department to see about impacts specific to your program in your county. But we also encourage you all that as you encounter issues locally around reopening that maybe doesn't fit kind of squarely into the guidance, please elevate those issues to your regional consultant or other folks in the Early Learning and Care Division or at the Department of Education. So while we're not through this pandemic and we're currently in this seemingly dire spike in infections, hope is on the horizon as we're hearing more about the distribution of vaccines. Not just one vaccine, multiple vaccines, until we get to a point where we have wide distribution and until public health officials say otherwise, we need to continue to protect each other by following their guidelines. And just again, while we're in this, we want to share some special appreciation for all programs serving families and those essential workers we all need. It's important to recognize that childcare is essential, and providers, whether they operate out of a center or a home, are all essential, and we appreciate your relentlessness and love for the families and children you serve. Now, as we look forward to our webinar plans for the upcoming weeks, we will close out 2020 with a webinar next Friday, December 11th, and then take a short break and resume our webinar series on Friday, January 8th, 2021. We know the governor's January budget will be released around then, so we may need to reschedule our January 8th webinar if it in any way conflicts with the governor's announcement. And in keeping with transparency, and as I mentioned in a previous webinar, we want to remind you today about the transition of child care programs to CDSS. You've heard this before, but the Budget Act of fiscal year 2021 transfers a number of child care programs to the Department of Social Services. We know that our stakeholders have great interest and questions about the transition, and we want to assure you that we are working very closely with CDSS to ensure the transition will be as smooth as possible. Many members of our CDE family will shift their employment to CDSS on July 1, They are deeply engaged right now to help think about and plan for how the work will move over, always keeping in mind the goal of providing seamless services to children and families and ensuring the burden on our contractors and providers isn't undue, easing those burdens. In just a moment, I will discuss the master plan, which was released earlier this week, and we'll highlight some specific statewide plans for the coming years. I'm looking forward to it and excited about what this means for early learning and care in the state of California. I'd also like to highlight some work happening at CDE as we look beyond the transition. Subscribers to the ELCD distribution list should have received an announcement of an upcoming session inviting stakeholders to partner with CDE to co-create a vision for high-quality preschool, early intervention, and P3 in California. We'll be holding this session on Monday, December 14th from 4:30 p.m. to 6 p.m. We're excited about the opportunity the master plan for early learning and care presents, and we'll be working to focus our resources on elevating the importance of high-quality, inclusive preschool, strong early intervention services, and transitions. We hope you will join us as we move forward together. And with that, I would like to turn it over to Erica for some opening words.
Thank you, Steve. You've said it all. Erica Otiono, Associate Director of the Early Learning and Care Division. We call ourselves ELCD. I hope your Thanksgiving break was a good one. I did. It was quiet, just myself, my husband, and my baby in the house. So I hope you had the same thing. I want to use this opportunity to once again thank you all for joining this webinar and for all your work, your continued work with children and families in your respective communities. We can't thank you enough. Providers, parents, teachers, coaches, program staff, directors, supervisors, advocates, thank you. As you know, the Program Quality Implementation Office, we call ourselves PQI, we're responsible for monitoring, training, technical assistance, and contract support. During the portion of the PQI part of this webinar, I will provide you with some updates and reminders from the PQI office. I want to end with a special thank you to all members of this webinar team, those in front and behind the scenes. Stay tuned, enjoy this session, and you'll hear from me shortly. Now over to Virginia.
Hi, everyone. Good morning. I'm Virginia Early, the administrator of our policy office in the Early Learning and Care Division. So again, just want to echo the thanks to all of you that Stephen and Erica shared earlier. We can't do this work without you. You inspire us every day, and we're working so hard to get you everything that you need to be successful and respond to things as they're bubbling up from the field. So my office is lead over issuing all the guidance that we've been working on and working with stakeholders like the legislature and the administration. So we're working on a number of different pieces of guidance. In just a minute, I'll give you an overview of what's upcoming and should be released to the field in the coming weeks. And I also know that there are a number of questions coming in the chat about, different things, in the Q&A box about different things related to requirements for shutdowns. And so I want to flag for folks that we'll also be sort of reviewing some of those pieces later in the webinar as well. So with that, I'll turn it over to Alana, who is our moderator.
Thank you, Virginia. Good morning, everyone. I'm Alana Andrade, and I'm a child development consultant in the policy office here at ELCD. I'll be moderating the webinar again today. And behind the scenes, we have a great team answering questions and also making this presentation run smoothly. From the policy office, we have Danielle Davis, Barbara Lindsay, and Eric Dunk. From the Program Quality Implementation PQI office, we have Cassandra Lewis, Crystal Devlin, Brittany Sheffield, Jer Zong, Richard Miller, Katina Boulay, and Serene Yee. From the Child Development, Nutrition, and Fiscal Services Office, CDNFS division, we have Corey Kahn and Alan Lynch. From the Child Development Management Information System, pardon, I always trip over that, CDMIS, we have Robert Halm and Carly Nundahara. And to answer any questions that you have regarding food programs and food program forms, we have Shashi Sharma from the Nutrition Services Division. When we get to the live portion of the question and answers, we will have our panelists here. And beyond that, we also have several administrators here to help answer your questions. We have Guadalupe Romo-Zendejas and Roseanne Pitts. And our team is committed to being as responsive as possible. A few kind reminders, please check the frequently asked questions or FAQs webpage to see if your question had already been answered. And if you send a question in the Q&A feature, please give us as much information as possible. Back over to Stephen to review the agenda for today.
Thank you, Alana. So as you heard from Alana, we have a great team on this webinar to address your questions and to help prepare us for today and each of our webinars. I marvel during every webinar just how dedicated this team is. I'm so proud to be able to work with them. As we normally do in today's webinar, you'll hear about our guidance updates as well as some updates in timelines for some of the funding streams, which we'll hear during the fiscal updates. We'll also be discussing the highlights of the master plan, and we'll be providing updates from our policy office and program quality implementation teams. We'll be taking some questions in addition to working through live questions as we're presenting. We'll start with the questions that have come in from our ELCD emergency email box. We may not be able to get through everything, but we'll do our best to address as much as we can. You can also use, as Alana mentioned, the Q&A function in Zoom to put your questions in. We'll do our best, again, to address as many as possible, but whatever we don't get to, we will take back to address as FAQs on our website. Perfect. So the last year's Budget Act, the 1920 Budget Act, funded the development of the Master Plan for Early Learning and Care. The intention of the Master Plan is that it will be used to translate California's aspirations into an actionable roadmap. The Master Plan was released on December 1st, 2020, so earlier this week on Tuesday, and provides us with a high-level overview of these goals. And I'll ask that Brittany put a link to the Master Plan in the chat if she hasn't already, for folks to read through. It's over 100 pages and is well worth your time to read. The vision of the Master Plan is to ensure that all of California's children thrive physically, emotionally, and educationally in their early years. To achieve this vision by 2030, the Master Plan outlines 4 key goals. So 1, improve the life outcomes of infants and toddlers by providing comprehensive early learning and care. 2, ensure that all families can easily identify, access, and choose a variety of quality early learning and care choices that fit the diverse needs of their children, their financial resources, and schedules. To promote school readiness through preschool for all 3-year-old children experiencing poverty, and universally for all 4-year-old children. And finally, to advance better outcomes for all children by growing the quality, size, and stability of the early learning and care workforce through improved and accessible career pathways, competency-based professional development supports, and greater funding. Emphasis, greater funding. Now I'll discuss the Master Plan recommendations. So specific to preschool, the Master Plan recommends that California build 1 unified system of state-funded preschool for 3-year-old children and 4-year-old children. The plan proposes to do this by aligning and strengthening current programs to create an enhanced preschool program for 3- and 4-year-old children, phased in universal preschool for all 4-year-old children, phased in access to preschool for all income-eligible 3-year-old children, starting with highest need areas. Now, while California has made significant strides by adopting legislation prohibiting preschool programs from expelling or disenrolling a child due to behavior, there is a need for greater accountability. The Master Plan proposes strategies to this end, which include providing California's 3- and 4-year-old children with access to a high-quality preschool experience, ensuring equitable, treatment of all children and eliminating bias through practices and training, and then supporting children's learning and development by enhancing educator competencies, incentivizing career pathways, and implementing supportive program standards. As part of facilitating their work with young children, early learning and care professionals working across a range of settings, which include homes, centers, and schools, need structural support. Specifically, every member of the workforce must have access to key competencies, career pathways, and program standards that support high-quality learning experiences, as well as provide affordable and accessible pathways for the entire workforce to advance in their competency and compensation. This is ultimately a long-term investment in the workforce. In addition, the recommendations include unify and strengthen programs and services to improve access and equity by streamlining requirements for birth through age 3 programs, providing access to early learning and care for all 3-year-old children experiencing poverty, and providing universal preschool access to all 4-year-old children. The state would unify and strengthen services to support learning and development. Another recommendation is unify funding to advance equity and opportunity, doing that by adopting a new reimbursement and rate model that brings all types of care and learning support into one structure that acknowledges costs associated with quality, including characteristics of children and competencies of the workforce. And then finally, streamline the early childhood governance and administration to improve equity. By designing and implementing data systems that support positive impacts on the results and quality of care for children through sharing and integration of data that impact the ways in which families and the workforce experience the system. That's the master plan in a nutshell. We encourage you to read the full document itself. We further encourage you to join us as we work off of the master plan to launch our work at CDE, as I described earlier. And now I will toss it over to Virginia to discuss the upcoming guidance.
Thanks, Steve. So, CDE recent and upcoming guidance. So first of all, we wanted to flag for all of you an email we sent on November 23rd to subscribers of our distribution list regarding interim guidance on the distribution of new federal funds to support state subsidized childcare and updates on pending allocations. So there are some key components that our Child Development and Nutrition Fiscal Services, or CDNFS, will cover today, but I wanted to speak first to the issuance of provider stipends. So we understand that, and we hear from childcare providers how significantly they've been impacted by the pandemic. And so we wanted to flag how in our communication we stated that contractors should make every effort to issue stipends to providers in early December. We also understand that contractors have been significantly affected by the pandemic as well. And we're hearing instances of where contractors have reduced administrative staff as COVID-19 cases have climbed over the last few weeks. So we really urge you, if stipends cannot be issued to all providers in the month of December for any reason, contractors must notify their early learning and care division regional consultant. So on to some upcoming guidance. So we received so many questions about the recent law change and what to do with the California state preschool contractors who've requested information about whether transitional kindergarten and kindergarten age eligible children are eligible to continue to be served in CSPP for the remainder of the fiscal year if they were served the previous year or enrolled due to the limited options that are existing right now for TK and in-person kindergarten. we want you to know that Management Bulletin 1508 was contradicting some of our other management bulletins and our funding terms and conditions. And so we wanted to let you know that we've clarified that management bulletin is rescinded. So we've taken it off of our website. We will be sending an email to subscribers on our distribution list about that shortly, but we wanted to verbally give you that update today. We are working very diligently to provide you with additional guidance on this issue. I know and this is a top priority, and we're hoping to release this guidance soon. Until we issue the guidance, please follow what we put in our email that we sent a bit ago that had the survey link in it, which is the basically to summarize that guidance. If you have any TK or kindergarten age eligible children in your CSPP programs, please do not disenroll them unless you're disenrolling them to transfer them to your CCTR or another child development contract, or they're disenrolling so they can enroll in kindergarten or TK. However, please do not enroll any new TK eligible or kindergarten age eligible children in these programs at this time. And the email also provided some information about other aspects as well. So we really want to thank all of our CSPP contractors who filled out the SNAP survey that we sent out before Thanksgiving so that we can gather the critical information from all of you that we need to inform upcoming guidance for serving 5-year-old children in CSPP during this fiscal year. So thank you. And thank you to all of our partners who helped us get the word out about that survey. So finally, in terms of guidance on family fees, we are continuing to work through this management bulletin. We apologize for the delay as it's taking a little longer than anticipated. However, please know that it's in the final stages, final stages, and we're expecting to release it in the next week. So that's all I have for now, and I will now turn it over to Erica for the program quality implementation update.
Thank you, Virginia. So on this slide number 8, there are 5 bullets. So PQI office, we want to give you update on continued funding application, CFA, the program quality management bulletin, the program self-evaluation, the Improper Elimination Payment Recovery Improvement Act, we call it IPARIA, and also talk a little bit about the transition to CDSS based on questions and emails and phone calls that we have received to date. Starting with the continued funding application, just want to say thank you so much. We have received so many continued funding applications. We have about 759 contractors. To date, we have logged in more than 700. That is good. We have about 52 more to go. Maybe you have sent them, it's still waiting to be logged in. Thank you. But if you have not, this is an opportunity for you to please get it to us as quickly as possible. If for any reason there's a delay, you please contact your consultant so we know that it's coming. Now, on to the next bullet, which is the Program Quality Management Bulletin. I know you've been waiting for this MB to come out so soon. Please be patient. We want to get it right. We just got the final stakeholder input. The team is working to incorporate some of those inputs, so please be patient. It's coming. The next bullet is program self-evaluation. You know, in Title V, 18279, it says, yes, every agency must complete a program self-evaluation every year and is due to CDE by June 1st of every year. This year with the pandemic, we are looking at doing a modified version of the program self-evaluation. So we're checking in with our legal office to make sure that we can do that. So please stay tuned, and definitely we'll reach out to you for your input. We're going to make sure that there's no administrative burden on that. It's going to be really, really reduced administrative burden. So stay tuned for the modified program self-evaluation. The next one is the IPARIA. This upcoming week, we have training on the IPARIA. The IPARIA is for agencies, not non-CSPP contractors. It used to include CSPP full-day programs, but not with this go around. So with the IPARIA, the schedule for next week, December 9th at 10 a.m., we have sent a revised, updated login information. Please use that one. The IPARIA is the review that is done every 3 years. 276 files selected statewide. We compile an error rate percentage for the state of California, and we report that to the Office of Child Care, Department of Health and Human Services. So I would highly recommend that you log in to listen to how we did the last one. The two reasons we're presenting this webinar to you are, one, we want you to share in our joy of having an error rate that is less than 4%. And guess what? We got written commendation from Office of Child Care for that. So, and then the next reason we also want to share this is that although we are at less than 4%, they still want us to reduce those error rates. Because as a state of California, even 2%, based on how much we get from the feds, is a lot of money in error. So it's our continuous improvement. So we want to share with you what we've promised the feds that we'll do, so that we'll all keep doing that together, just like you have done, to reduce this error rate from where we started to now, less than 4%. The last item I want to talk about is the transition to CDSS. We have received so many questions about monitoring, training, support, contract. How is it gonna look like? We have the same questions like you do. However, progress has been made. I can tell you a couple of things that we know. One, the move is going to happen July 1. That's obvious. Okay. Two, we know that 81 of the 109 staff at ELCD will be moving over to CDSS. They just got a list last week, so we're waiting for some more transition planning, co-planning with CDSS. We also know that CDSS, that they are involved in so many stakeholder sessions, and we highly encourage you to participate. That way you can pose your questions to CDSS. It will be answered. It has been very interactive and informative so far. We are coordinating with CDSS to make sure that we're giving you the same answers to your questions. So stay tuned. Stay tuned. Lastly, on the transition to CDSS, they plan to make a change or no change to the contract or to the process. Hearing the executive director at the onset of the stakeholder sessions, Kim Johnson, the executive director, specifically said that they have no plans to make immediate changes to the process right now. So let's stay tuned, ask all the questions we have. We'll be as transparent as we can. Whatever information we have, we'll provide that to you. Thank you so much. Keep sending us those questions. We're all here. On behalf of all ELCD staff, myself, I'm available to you. You have my email, you have my phone. Reach out to us and we'll answer any questions that we possibly can answer. I'm gonna hand it over next to Crystal Devlin, a consultant in PQI, who's going to expand on the COVID-19 closure and reimbursement, another area that we have been getting questions from. So Crystal, hopefully you're ready. So you're next. Thank you, everyone.
Thank you, Erica. Good morning, everybody. As Erica said, my name is Crystal Devlin, and I'm a child development consultant in the Program Quality Implementation Office. And we have been receiving a lot of questions in regards to Management Bulletin 2018 and the requirements for being reimbursed when direct service contractors are required to close all of their sites and or classrooms due to COVID-19. So we're going to discuss that a little bit further now. COVID-19 closure notification or verification of closure forms are only required if an agency closes all sites and or classrooms for each of their contract types. Closure forms are not required if an agency has any classrooms and or sites that are open and providing in-person services for children and families. A direct service contractor whose programs are not located on an LEA campus that closes all sites and classrooms due to a public health order in accordance with Senate Bill 820 must follow the directives in Management Bulletin 20-18 and submit a notification of closure due to a public health order template, along with a copy of the local or state public health order that requires the closure to their assigned Program Quality Implementation Office regional consultant. Must submit a distance learning plan in accordance with the policy directives included in Management Bulletin 20-17 and offer distance learning services to children and families that are not receiving in-person services. A direct service contractor who is operating their sites and or classrooms on a local education agency campus that is required to close because the LEA campus has been mandated to close. And the LEA governing authority will not allow the early learning and care program to be open for in-person services, must follow the directives in Management Bulletin 20-18 and submit a verification of closures template signed by the LEA governing authority to their assigned PQI office regional consultant, must submit a distance learning plan in accordance with the policy directives included in Management Bulletin 20-17, and offer distance learning services to children and families that are not receiving in-person services. Direct service contractors that close all of their sites and classrooms, but some of those sites and classrooms are closed due to a public health order, and others are located on an LEA campus that have been required to close because the LEA governing authority has mandated the closure, must follow the directives in Management Bulletin 20-18 and submit both a notification of closure due to a public health order for the sites and classrooms that are closed due to the public health order, along with a copy of the health order, as well as a verification of closure signed by the LEA governing authority for those sites and classrooms that are located on an LEA campus that has been mandated to close by the LEA authority. You must also submit the distance learning plan in accordance with the policy directives included in Management Bulletin 20-17 and offer distance learning services to children and families not receiving in-person services. If an agency has any sites and or classrooms that are open and are providing distance learning for children and families that are not receiving in-person services, there is no need to submit a closure notification or verification template. Contractors who are closed in accordance with these requirements will be reimbursed at the lesser of 100% of the contract's maximum reimbursable amount or net reimbursable program costs during fiscal year 2020-21. Contractors that are closed due to a non-COVID-19 emergency must follow the directives described in Management Bulletin 20-20 in order to continue to receive reimbursement for fiscal year 2020-21. For direct service contractors that close all classrooms and sites without a public health order, a closure mandate by an LEA authority, or due to a non-COVID-19 emergency, may be eligible for partial reimbursement based on the number of days the program is open for in-person services. In any of these instances, contractors should contact their assigned Program Quality Implementation Office regional consultant for additional guidance. Again, as a reminder, there is no need to submit a closure verification or notification of closure unless all of your sites and classrooms are closed for in-person services. And now I'll hand it over to Alan Lynch in the Child Development, Nutrition, and Fiscal Services Unit for some fiscal updates.
Thank you, Crystal. Good morning. As she said, my name is Alan Lynch, and I am manager in the Child Development, Nutrition and Fiscal Services Office. So due to the increase in temporary program or classroom closures due to COVID-19, we have again been receiving questions about how to report attendance and enrollment data, as well as questions about whether or not the contractor will be reimbursed. The next two slides are to go over this information once again. This first table, we see the reporting requirements for CDMIS 801A data, as well as the CDNFS 8501 or 9500 reports that are submitted in CPARIS. If a child is receiving in-person services, for the 801A reporting, there is no change to the reporting guidelines. For the reporting in CPARIS, for your CDNFS reports, report the days of attendance, including excused absences, for any child that was expected to physically attend the program. If a child is participating in distance learning activities, once again for the 801A reporting, report the enrolled families on the CDD 801A who received distance learning services. In CPARIS, on your CDNFS reports, do not report the days of attendance for any children participating in distance learning activities. I'd like to also review one of the Q&As posted on our webpage, as it seems to be a common question that we are receiving. The question is, what do we put on the attendance sheet if we have to close one classroom due to COVID-19? As Crystal said earlier, when a classroom is closed due to COVID-19, contractors are required to offer distance learning services for enrolled children and document the distance learning services offered in accordance with the policy directives in Management Bulletin 20-17. On the attendance sheet, the contractor will indicate that the center has been closed due to COVID-19 and/or that the child is absent due to the center's closure. On the CDNFS fiscal attendance report submitted in CPARIS, contractors should only report those days of attendance in which the child is physically being served in the classroom for that reporting period. Please note that while you are not reporting days of attendance for the children participating in distance learning activities, you would still report their days of enrollment during the closure caused by COVID-19. We will go over that a little bit more on the next slide. Thank you. Okay, so I'll go through this table kind of quickly, but it's guidance specific to the time period that we are currently in, which is the reporting between the dates of September 8th, 2020 and June 30, 2021. So for the reporting period, days of operation for the current period, September 8th through June 30th, report days of operation that the program is A, physically open and providing care, or B, days the program is not physically open due to a written state or local public health order or guidance. Per Senate Bill 98, a contract's maximum reimbursable amount, or MRA, will be prorated if A or B is not met. For the days of enrollment reporting field, report enrollment associated with days of operation only for enrollment on days where the program is A, physically open and providing care, or B, days the program is not physically open due to a written state or local public health order and guidance. In other words, if you were closed due to a written state or public health order or guidance, you may report the days of operation and days of enrollment as if you were providing care. Alternatively, if you were closed without a written state or public health order or guidance, contractors will not report the days of operation or enrollment during this time of closure, and a contract's MRA will be prorated. This closure and reporting information has been shared by Crystal and me is provided in greater detail in Amendment Bulletin 20-18, titled Reopening and Reimbursement Requirements for Direct Service Contractors, and is also included on the CDNFS webpage within the fiscal year 2021 contract changes letter. If you need to reference this information in the future, you can definitely find it on our webpage. Okay, so further fiscal updates. On November 23rd, the CDE issued an email to subscribers on the distribution list titled Interim Guidance on the Distribution of New Federal Funds to Support State Subsidized Childcare and Updates on Pending Allocations. This communication included that the CDE will receive $110 million in additional funding to support waived family fees, over earnings due to school-aged children requiring full-time care, and extending the timeline for temporary emergency childcare services beyond what is provided in Senate Bill 820. This communication also provided a timeline for all pending allocations. On or about December 18th, alternative payment contractors will receive a contract amendment to cover July and August family fee waivers to pay a secondary provider due to a primary provider closure due to COVID-19 in September and/or October, and the extension of care for families currently enrolled in emergency childcare. We understand that some contractors do not currently have sufficient funds within their contract to continue care for emergency childcare families because their previously allocated funds for this purpose will be exhausted this month. Therefore, the CDNFS is going to utilize the most current data submitted, which is the October 2020 expenditure data, and provide the equivalent of 3 months of funding in the next apportionment payment that will be processed, which is the payment that will be received by contractors at the end of this month. By doing so, contractors should have sufficient funds to cover operating costs and provider payments while they await the contract amendment that will be received in a couple of weeks. Next, I wanted to provide a short update regarding family fees as they relate to contractors' January payment. We would like to make contractors aware that their January 2021 payment, which will be received at the end of December, will incorporate data that you have reported on the line, waived family fees for certified children, September through June. In previous months, this amount was subtracted from reimbursements to the contractor because waived family fees in this timeframe were to be absorbed by the contractor and/or provider. Now that waived family fees do not have to be absorbed by the contractor or provider, the amount reported on this line will be incorporated in the contractor's reimbursement calculation for all contract types. Okay, now for the final fiscal update slide. The following is a question we've been receiving lately. Can the one-time provider stipends included in SB 820 be included as countable income in the 1099 tax forms? We would like to thank you for your trust in us in asking this question, but the CDE is not in a position to give advice on whether the IRS will ultimately view it as wage replacement or qualified relief. As tax laws shift, please seek tax advice from a qualified professional. And that is it for the fiscal updates. I will now turn it back over to Alana for the live question and answer portion of the webinar.
Thank you very much, Alan, and to the rest of our panelists. So I will begin. So the first one is, I'd like to ask Erica to come back. There was someone who was confused about if those who have a CSPP would be a part of the IPERIA webinar that's happening.
Oh, thank you, Lana. For the question about the IPERIA is, if you have a CSPP only contract, no, you're not required to participate. However, if you're interested in sharing the joy, you can participate. So, but CSPP contractors, part day and full day, no. But all other contracts, yeah, yes.
Excellent. Thank you for sharing the joy, Erica. So I'd like to invite Roseanne to answer. So Roseanne, we've had a lot of questions regarding if the program self-evaluation is still due and if ITERs and ECHRs and other assessments are still due. and also when that guidance would be released.
Hello. Nice to see so many people online today. The management bulletin will come out. There has been a bit of a delay. I think Erica explained that, but the management bulletin will be out soon regarding all the different quality measures and how you would report them. Program self-evaluations are due on June 1st. So you will get a management bulletin that will tell you about program self-evaluations probably sometime in March. So you're not behind yet. You have plenty of time, and we will explain that process this year. We hope to be able to modify it a little to make it easier for contractors during this COVID time, but we would still like you to evaluate how your program has helped children and families during this difficult time. If your program has not been opened, then an ECHRS will not be required because your classroom is not opened. If your classroom is opened, we would still like you, I believe, to do a self-evaluation of those classrooms, but we know the scores will look different this year.
Perfect. Thank you very much. So I'd like to invite Stephen back. There are a lot of questions regarding the master plan, which is not a CDE issued document, and how our programs will interact with that. So if you could just give another overview of how the master plan is and how CDE will just eventually be issuing, and keeping this in mind as we continue forward.
Yeah, thank you for that, Alana. So yeah, the master plan it's not a CDE document. It is a product of the administration, the Governor Newsom's administration. But I think one way to view it is it's an inclusive and unifying plan. It includes not just programs that are at CDE presently or will be transitioning to CDSS. It's inclusive of, let me say that another way. It's not just inclusive of, say, like state preschool, which is at CDE. I highlighted some of preschool, but it is also absolutely inclusive of, I mentioned infants and toddlers, and those are part of the programs that are moving over to the Department of Social Services. So general child care, the APs, other programs that serve infants and toddlers. And so it's an inclusive document. It's an inclusive plan. It includes family child care providers, centers. It's an inclusive plan. I hope that's helpful.
Perfect. Thank you, Stephen. I would like to ask Virginia to speak. There are a lot of questions regarding the guidance around transitional kindergarten and CSBP. And if you could just give a brief overview.
Sure, thanks so much. So I just want to just sort of, there seem like there are a lot of questions saying, why was this change made? So that, you know, what CDE is trying to navigate is further guidance on a law that was implemented at effective, I believe, July 1st, 2019, and was incorporated for the first time in the 2019-20 funding terms and conditions, and then again in our management bulletin 2001. And so specifically that law, and you can look it up yourself, that's in Education Code section 8208, paragraph AJ. It's a long section, paragraph AJ. So basically that changes the definition of what a 3- and 4-year-old is to sort of previously children that were eligible for the 3-month window of TK from September to December birthdays. Previously, they were legally allowed to choose between TK and CSBP, And now this law has been written such that those children would not have the option anymore of attending CSPP. However, we know that this is a very unique year, and we know that this is a new law. And so there's some, knowing that there are 12-month eligibility considerations and factors around, children who are already enrolled, we're working through different pieces to see sort of on a temporary basis what can be done this year within our existing legal authority around children that are already enrolled, that are TK and kindergarten age eligible. But we just want to point people to the fact that the education code has changed. And that's why I know some of you were asking which management bulletin was Virginia saying was rescinded. I just want to repeat that. It's Management Bulletin 1508. That was one that I know some of you had been confused that whether you should be following that or the funding terms and conditions in our more recent ones. And so we've pulled 1508 off of our website. So hopefully that won't be a source of confusion. And the email, for those of you that are looking for our interim guidance, I just want to reiterate where you can find that. We sent an email out to subscribers of our listserv on Thursday, November 19th around 4:20 p.m. And so that has our interim guidance in writing for what to do about children who are already, who are in this age category and who are already enrolled. You'll notice that there's a survey request with a survey link asking for data on the number of children that are in this situation so we can navigate our guidance. That survey is closed, but if you did not respond, our CDMIS team will be we'll be working with the folks that haven't responded to get their information as well.
Excellent, thank you. So we had a lot to review since we were not here last Friday, and we unfortunately are coming up to the end. So let's see how much our team is still answering a lot of your open questions. Let's see if there's another one that we can speak to out loud. There was also a lot of questions asking where to get a copy of this PowerPoint, and just to let everybody know that it is on our ELCD COVID-19 webpage, and I will be reading that out loud in just a moment. They are archived there. You can get a transcription, you can get the slide deck, and because per accessibility issues, or not issues, per accessibility, we must put a transcript, which means that it takes time for us to write down everything that we said in an hour to be up there. So please feel free to look at that website and you will see our previous webinars plus this one.
Yeah. So the slide deck is typically easy to get up fairly fast, and the webinar recordings take a little bit more time because they require a transcription.
Yes, excellent. So while our team is answering more of the questions in the question and answer feature. Yes, thank you. I'll read off that resource, but perhaps out loud, can we ask either Alan, Corey, or Virginia just to briefly speak about the stipends for providers and which contracts that they're reminded to?
I wasn't sure if it was me or Corey. So yeah, just the stipends are for alternative payment providers. So that's why if you don't have an alternative payment contract, you may have been a little confused when I said share this information about the stipends.
Perfect, thank you. Okay.
I will add and piggyback to that. So when Virginia says alternative payment type contract, that includes stage 2, stage 3, and alternative payment. So that's CAPP and also CMAP.
Perfect. Thank you very much for that last minute clarification. And I will read off the resources while our team is still answering questions. You can find the webinar slides and the management bulletins and FAQs on ELCD's COVID-19 guidance webpage at https://www.cde.ca.gov/SP/re/ELCD COVID-19.asp. You may also submit additional questions to the ELCD emergency email inbox at elcdemergency@cde.ca.gov. To contact your assigned PQI office regional consultant, a list of consultants can be found on the ELCD Consultants Regional Assignments webpage at https://www.cde.ca.gov/SP/cd/CI/assignments.asp. Consultants are most easily reached by email. But if you must, you can call at 916-322-6233. To contact your child and adult care food program county analyst, a list can be found at https://www.cde.ca.gov/ls/cc/cacfp contact.asp. And thank you. I'd like to ask Erica to come back and close us out.
Thank you, Alana. On behalf of ELCD, CDE staff, I want to thank you again for participating. As we continue to adjust and adapt to our current reality, please let's continue to take care of ourselves and everyone around us by wearing masks, continue the physical distance and the hand washing. Together, we'll get through this. Thank you and stay safe. Over to you, Steve.
Thanks, Erica. I think we're of the same mind here. On behalf of the team here at CDE, who are continuing to work to support children, families, and provider professionals, we want to thank you for taking time out of your morning to listen to this morning's webinar and engaging us with the Q&As. We hope you'll join us for the next one next week. With that, I'll reiterate what Erica shared and just ask us all to take care and be safe and be kind to one another. Please keep your gatherings small, follow public health orders. We can't do this without you, and we're looking forward to getting back to normal. We'll get there together. Thank you, everyone, and we hope to see you next week.